Welcome to today's session. I am Jemisha, working as assistant professor at Emmanuel Arthur College of Pharmacy. In this video, we will learn about congestive heart failure. Definition: heart failure is a progressive clinical syndrome caused by inability of the heart to pump sufficient blood to meet the body's metabolic needs. Heart failure can result from any disorder that reduces ventricular filling. Ventricular filling means the ventricle cannot relax and fill properly during diastole. It is termed as diastolic dysfunction and reduced myocardial contractility. Reduced myocardial contractility means the heart muscle cannot contract forcefully during systole. It is termed as systolic dysfunction. So, the heart failure is the condition in which the heart cannot pump enough blood. The image of normal heart, and the patient with heart failure has weakened heart muscle, ventricle is stiff and unable to fill up blood normally, dilated ventricle, unable to pump heart efficiently, enlarged heart is seen in patient with heart failure. Next, etiology of heart failure. Etiology means the causes of heart failure. The causes include long-standing hypertension. The main causes include long-standing hypertension, heart valve problems, cardiomyopathies, and coronary heart disease or heart attacks. So, the main causes include long-standing hypertension. Long-standing hypertension means increased blood pressure that persists for a long period, like months to years, which is usually uncontrolled. Next, heart valve problem means heart valve do not open or close properly, which leads to abnormal blood flow. Next, cardiomyopathy means weak or damaged heart muscle. Next, coronary artery disease. Coronary artery disease is a condition where the coronary arteries become narrow or blocked by atherosclerotic plaque, reducing blood supply to the heart muscle. It is termed as coronary artery disease. These are the main causes of heart failure. The rare causes of heart failure include amyloidosis, arrhythmias, systemic lupus erythematosus, drugs such as chemotherapeutic agents, excessive alcohol consumption, and HIV cardiomyopathy. So, amyloidosis is a condition in which abnormal amyloid proteins accumulate in tissue and organs, disrupting their normal function. It is termed as amyloidosis. Next, arrhythmias. Arrhythmias means heartbeat irregularly, which means it will beat too fast or too slow. Too fast is termed as tachycardia and too slow is termed as bradycardia. Next, systemic lupus erythematosus. Systemic lupus erythematosus is a disorder of autoimmune disorder which attacks body's own tissues, causing inflammation in multiple organs. Next, drugs such as chemotherapeutic agents. Chemo drugs directly damage myocardial cells, which leads to reduced contractility of the heart muscle. Next, excessive alcohol consumption. Excessive alcohol consumption can also directly damage myocardial cells, which leads to reduced contractility of the heart muscle. Next, HIV cardiomyopathy is caused by HIV virus. HIV infection leads to damage of heart muscle, causing reduced contractility and heart failure. Next, classification. First, based on functional abnormality. Based on functional abnormality, it is classified as systolic heart failure and diastolic heart failure. Systolic means contraction and diastolic means relaxation. So, systolic heart failure occurs due to reduced pumping ability of the heart with decreased ejection fraction. So, ejection fraction means how much blood the heart pushes out every time it beats. Normal ejection fraction is 55 to 70%. If the ejection fraction is below 55%, it is considered as the heart's capacity is low, pumping capacity is low. Next, diastolic heart failure. Diastolic heart failure occurs when the heart contracts normally but fails to relax and fill properly with normal or increased ejection fraction. Next, classification. Based on duration, it is classified as acute heart failure and chronic heart failure. Heart failure, sudden and rapid onset of heart failure with rapid fall in cardiac output and hypotension, usually after myocardial infarction or valve rupture. Acute heart failure is the condition where the heart suddenly becomes unable to pump blood effectively. That is acute heart failure, rapid onset of symptoms. Next, chronic heart failure. It develops slowly and progressively due to conditions like hypertension, valvular heart disease, or COPD, means chronic obstructive pulmonary disease with gradual reduction in cardiac output and peripheral edema. Chronic heart failure is a long-term condition where the heart gradually loses its ability to pump blood effectively over time. It's a it's a long-term heart which develops slowly. Next, based on which side is affected, it is classified as left-sided heart failure and right-sided heart failure. Left-sided heart failure, most common type of heart failure. Heart loses some of its ability to pump blood out to your body after it's been reoxygenated, usually caused by coronary artery disease. In left-sided heart failure, left ventricle fails to pump blood effectively, causing blood to back up into the lungs. Next, right-sided heart failure. Heart loses some of its ability to move oxygen depleted blood to the lungs to pick up new oxygen, most often caused by left-sided heart failure. Can also occur even when the left side of the heart is apparently normal. In right-sided heart failure, right ventricle fails to pump blood effectively, causing blood to back up in the body, which leads to swelling. Next, pathophysiology of heart failure. So, this in first step, myocardial injury. Myocardial injury means damage of heart muscle. Uh, Damage of heart muscle causes decreased pumping ability of the ventricle, which leads to reduced cardiac output. In step 2, body senses low output, reduced carotid baroreceptor stimulation, decreased renal perfusion. Decreased renal perfusion means kidney gets less blood, so the body thinks BP is low, so it releases renin. Next, in step 3, compensation mechanisms activated. The two major systems get activated here: sympathetic nervous system and renin angiotensin aldosterone system. The sympathetic nervous system increases heart rate and increases contractility. Renin angiotensin aldosterone system. Angiotensin 2 causes vasoconstriction, which leads to increased afterload. Aldosterone causes sodium and water retention, which increases preload. So these systems, this sympathetic nervous system and the renin angiotensin aldosterone system gets activated and increases the afterload and preload. In step 4, heart structure changes, which means the heart becomes enlarged and thickening, called negative remodeling. The final outcome is worsening of heart function, symptoms of heart failure. Next, clinical manifestation. Clinical manifestation means sign and symptoms. The sign and symptoms of heart failure are shortness of breath, chronic cough or wheezing, swelling in legs, ankles, and abdomen, fatigue and weakness, dizziness, weight gain from fluid retention, tachycardia, paroxysmal nocturnal dyspnea, atrial fibrillation, ventricular arrhythmias. So, shortness of breath means the patient may feel difficulty in breathing. Chronic cough or wheezing. So, the patients may feel chronic cough and wheezing. Swelling in legs, ankles, and abdomen because of fluid retention. Next, fatigue and weakness. Fatigue means extreme tiredness, dizziness, weight gain, weight gain from fluid retention. Next, tachycardia. Tachycardia means the heart beats too fast. Next, paroxysmal nocturnal dyspnea. Paroxysmal nocturnal dyspnea means a person suddenly wakes up at night with severe shortness of breath, due to fluid accumulation in lungs. Next, atrial fibrillation. Atrial fibrillation means an arrhythmia where the atria beat rapidly and irregularly, leading to an irregular and often fast pulse. That is atrial fibrillation. Next, ventricular arrhythmias. Ventricular arrhythmias means heart's ventricle beat abnormally, means too fast or too slow. So these are the clinical manifestations of congestive cardiac failure. Next, diagnosis. So these are the diagnostic tests for confirming congestive heart failure: BNP test, chest X-ray, ECG, echocardiogram, and laboratory investigations. First, BNP test. BNP test stands for B-type natriuretic peptide. It measures the level of BNP in blood, which increases in heart failure due to ventricular stretching and fluid overload. BNP level above 100 pg per ml suggests heart failure. So, if the value is above pg per ml, it suggests heart failure. Next, chest X-ray. Chest X-ray is the imaging test used to detect heart enlargement and fluid accumulation in lungs. Chest X-ray shows enlarged heart, pleural effusion, or pulmonary edema. Next, ECG. ECG means electrocardiogram, is a test that records the electrical activity of the heart to detect rhythm and conduction abnormalities. So, ECG detects ventricular hypertrophy or rhythm abnormalities. Next, echocardiogram. Echocardiogram is an ultrasound test that visualizes heart structure and function. So, the echocardiogram determines the ejection fraction and identifies structural abnormalities. Next, lab investigation. A laboratory test for identifying disorders that may worsen cardiac failure include CBC, which means complete blood count, serum electrolytes, renal function test, hepatic function test, and thyroid function test. Next, risk factors of uh, heart failure. So, the risk factors are hypertension, diabetes mellitus, congenital heart defects, coronary artery disease, previous MI, advanced age. Lifestyle risk factors include smoking, obesity, physical inactivity, and unhealthy diet. So, hypertension means increased blood pressure, diabetes, hyperglycemia, high glucose level in blood. Next, congenital heart defects, which means the patient has heart defects since birth. Next, coronary artery disease. Coronary artery disease is a condition when the coronary arteries become narrow or blocked by atherosclerotic plaque, reducing blood supply to the heart muscle. Next, previous MI. MI, myocardial infarction, means heart attack. Next, advanced age. Um, Above 65 years are at risk for developing congestive cardiac failure. Lifestyle risk factors include smoking, obesity, physical inactivity, and unhealthy diet. So, smoking can cause congestive heart failure because smoking reduces oxygen delivery, damages blood vessels, and worsens heart failure progression. Obesity, increased weight can also cause congestive heart failure. Physical inactivity and unhealthy diet which includes fried items, bakery foods which contains trans fat and saturated fat, which can develop atherosclerosis, which narrows the blood vessels, can cause heart failure. Next, complications of heart failure include thromboembolism, acute pulmonary edema, atrial fibrillation, ventricular arrhythmias, cardiorenal syndrome, liver dysfunction, heart valve problems, and pleural effusion. Mm, Congestive heart failure leads to thromboembolism because poor cardiac pumping causes blood stasis, which promotes clot formation that can block vessels. Acute pulmonary edema, which means fluid accumulation in lungs. Next, atrial fibrillation. Atrial fibrillation is an arrhythmia where the atria beats rapidly and irregularly, leading to an irregular and often fast pulse. Ventricular arrhythmias. Ventricular arrhythmias means heart's ventricle beat abnormally. Next, cardiorenal syndrome. Cardiorenal syndrome means the heart and kidneys affect each other's function negatively. In congestive heart failure, reduced cardiac output decreases renal blood flow, leading to kidney dysfunction and fluid retention, which further worsens heart failure. Next, heart valve problems, liver dysfunction, and pleural effusion means fluid accumulation uh, in the lungs. Next, next management goals of treatment. Goals of treatment means the target set to improve the patient's health and control the disease. In simple words, what we want to achieve by giving treatment. The goals of treatment is to improve quality of life, relieve or reduce symptoms, minimize hospitalizations of patients, slow disease progression, and prolong their survival. Next, non-pharmacological management. Non-pharmacological management means the treatment of a disease without using medicines. Means treating disease using lifestyle changes, diet, physical methods instead of drugs. The non-pharmacological management includes limit salt intake. Limiting salt reduces sodium and water retention, which decreases blood volumes, lowers edema and pulmonary congestion. Next, fluid retention in moderate or severe cases. In moderate to severe cases, fluid is restricted usually to 1 to 1.5 liter per day to prevent fluid overload. Next, weight management. Weight should be reduced because excess body weight increases the heart's workload. Next, regular moderate aerobic exercise, example walking, which improves functional capacity. Next, smoking cessation to prevent further cardiac damage because smoking reduces oxygen delivery, damages blood vessels, and worsens heart failure progression. Avoid or limit alcohol consumption because alcohol depresses heart muscle function and may interact with heart failure medications. So, alcohol should be avoided. Avoid high fat foods and processed foods. Fat foods like fried foods, fatty meats, bakery items should be avoided, and processed foods like instant noodles, ready to eat meals should be avoided because these foods can worsen atherosclerosis, increases BP, and weight gain. So, these foods should be avoided. Next, pharmacological treatment. Pharmacological treatment means the treatment of a disease using medicines, which means treating diseases by giving drugs. First, AC inhibitors. AC inhibitors, angiotensin converting enzyme. It is the first line therapy in heart failure with reduced ejection fraction. The mechanism of action of AC inhibitors is block the conversion of angiotensin 1 to angiotensin 2, leading to vasodilation and decreased aldosterone secretion. The side effects of AC inhibitors are dry cough. The main side effect of AC inhibitor is dry cough. Next, hyperkalemia, which means increased potassium levels, and hypotension. Hypotension means low BP. And the examples of AC inhibitors are captopril, enalapril, and ramipril. Next, diuretics. Diuretics means which increases the urine production. First, loop diuretics. It gives relief from pulmonary and peripheral edema by promoting urine production, urine excretion. Next, mechanism of action inhibits sodium potassium co-transporter in the thick ascending limb of loop of Henle, promoting diuresis. The side effects of diuretics include hypotension, which means reduced BP, hyponatremia, means low level of sodium, hypokalemia, means low level of potassium. Example of loop diuretics are furosemide and torsemide. Next, beta blockers. Beta blockers are used in stable chronic heart failure with reduced ejection fraction. It reduces disease progression and mortality. The mechanism of action of beta blockers is block beta 1 adrenergic receptors, decreasing heart rate and myocardial contractility. The side effects of beta blocker is bradycardia and fatigue. Bradycardia means the heart beats too slow. Fatigue means extreme tiredness. The example of beta blockers are bisoprolol, corbidelol, and metoprolol. Next, aldosterone antagonist, moderate to severe. It is used in moderate to severe high heart failure with reduced ejection fraction, shown to reduce mortality. The mechanism of action of aldosterone antagonist is it blocks the aldosterone receptors in distal nephron, reducing sodium retention and myocardial fibrosis. The side effects of aldosterone antagonist are hyperkalemia and dizziness. Hyperkalemia means increased levels of potassium. The examples of aldosterone antagonists are spironolactone and eplerenone. Next, cardiac glycoside. Digoxin improves cardiac function, quality of life, and heart failure symptoms in patients with heart failure with reduced ejection fraction. The mechanism of action of cardiac glycoside is it inhibits sodium potassium ATPase pump, increasing intracellular calcium and enhancing myocardial contractility. The side effects of cardiac glycoside are nausea, vomiting, dizziness. Example is digoxin. Next, surgical treatment for heart failure. Heart transplantation may be recommended for a person who does not respond to medication. So, the conclusion of congestive heart failure is congestive heart failure is a long-term medical condition where the heart becomes weak and cannot pump enough blood to meet the body's needs. This leads to fluid buildup in the lungs and other parts of the body. Early diagnosis, proper medicines, lifestyle changes, and regular follow-up can help control symptoms, improve quality of life, and reduce complications. And there are many types of congestive heart cardiac failure classified based on the duration, based on side of the heart affected. These all can be managed by lifestyle changes, medicines, early diagnosis, and regular follow-ups, which can improve quality of life and reduce complications. Thank you.